Good afternoon and welcome to today's Way Forward Workshop Leader Lunch Break, where we are thrilled to welcome Emily Campbell. Last Friday at the City Club, the Local Heroes series welcomed a widely respected local hero to the stage to enlighten the attendees about the importance of advocacy in driving social change. That hero, of course, was today's guest, Emily Campbell. Emily took the helm at the Center for Community Solutions after more than 16 years of service in the organization, elevating our collective consciousness on issues of poverty, the benefits cliff, and public and private funding of health and social services. While you may not have heard her voice until recently, you have experienced the impact of her work for years, from her days in the halls of Congress on Capitol Hill to work with the Ohio Department of Health in drafting strategic plans to end the HIV/AIDS epidemic, to her highly effective advocacy work at the center, assimilating and analyzing data to inform solutions and drive action on our community's most vexing challenges in poverty, health, social well-being, and an inclusive economy. Her work on poverty has appeared in every major newspaper in Ohio, and she has been interviewed by a wide variety of media outlets, including The Economist, The New York Times, ESPN, MSNBC, and NPR. Now, in the 2 short months since she took the helm, she is speaking forcefully about our deepest vulnerabilities and largest disparities and the importance of developing novel and innovative approaches to help those in need. In her words, our past challenges and even the struggles of today don't have to preordain our region's prosperities in the future. And continuing, I believe that a focus on people can propel progress in Cleveland and beyond. And when this local hero left the stage at the City Club, she left a room full of inspired and informed future advocates who awarded her with a standing ovation. She's been honored with recognition from Crain's as 40 Under 40 and has served on the chair of the Literacy Cooperative. Emily, we're pleased to have you with us today.
Thank you so much for having me here today. I'm so glad this is recorded so that I can listen to that wonderful introduction on the days when the work gets really hard and it feels like we're swimming against the tide, because it's a wonderful reminder that, even if you feel like you're shouting into the void sometimes, that people are still listening. So thank you, Marianne, for that warm introduction. And thank you to the Cleveland Leadership Center for having me here today. What I want to talk about today is the Center for Community Solutions, the organization that I was tapped and tasked with leading, stepping into the role on December 1st of last year. The Center for Community Solutions is a nonprofit, nonpartisan policy think tank. We engage in improving health, social, and economic conditions. It's our applied research and our policy analysis that sets us apart, and we work to identify, analyze, and explain data and issues related to health and social services and propose nonpartisan solutions to improve the lives of Ohioans. I want to pause and talk a little bit about being nonpartisan, and solidly and unapologetically nonpartisan. The Center for Community Solutions believes that solutions can come from anywhere. We also believe that bad ideas can come from anywhere. And so when we are looking at policy proposals, we evaluate them on their merits, not based on who put them forward. It also enables us to work with anybody. And there are often times when we are collaborating with policymakers from both sides of the aisle to try and come up with solutions to move our community forward. Now, sometimes the reasoning behind why they support a particular policy solution don't always align, but that's okay. We are interested in policy change, and trying to implement policies that can impact communities and propel us all forward in a positive light. So our policy work amplifies community voice and helps make sense of complex systems. Our research reveals changes in the health and human service space and informs next steps. And direct service organizations, funders, and policymakers, many of you, use our data and analysis to develop actionable strategies to develop health, social, or economic support for Ohioans. So while we study issues, we also actively engage in direct advocacy to try and change policy, practices, or perspectives. Now, we don't always lead from the front, but we typically have at least a seat at the table, if not influencing from behind the scenes. My colleagues did the analysis showing, for example, that there is a 23-year difference in life expectancy between two census tracts in Cuyahoga County that are just 2 miles apart. We are talking 23-year difference in the amount of time someone born today in a census tract near University Circle and someone born in a census tract in Shaker Heights, just 2 miles away. We recently spotted that map being used in a presentation by a local board of health. We want you, please use our work, share it widely, keep our logo on it if you don't mind. And if you do use any of our analysis, please drop us a line, because there is nothing better than hearing about how our work is useful and used. We love sharing these stories amongst ourselves. Usually I talk about poverty. As Marianne mentioned, I spoke at the City Club on Friday, and I'd strongly encourage you to check out the recording, and I go into much more depth than today's time will allow and talk about 5 things we need to understand about poverty in Cleveland. So I'm going to skip talking about poverty today, although if you have questions, I'd be happy to talk about it in the Q&A. What I do want to talk about is community solutions itself. Some of you have probably heard our origin story. In 1913, after 5 years of study, a group of wealthy philanthropists, do-gooders, and the Chamber of Commerce came together to form the Federation for Charity and Philanthropy. It would pool resources, examine issues from a community-wide perspective, create plans to meet needs, and propel progress. There have been many twists and turns along the way. In the 1970s, the federated giving went one way and became United Way of Greater Cleveland, and the planning and policy work went the other to become first the Federation for Community Planning and now the Center for Community Solutions. So how does a 111-year-old institution remain relevant? It's by being flexible, by periodically taking the time to lift up our heads and attempt to take a clear-eyed look at where our community is today, not where it was or where we wish it were. Sometimes it means adapting to the issues of the day, but more often than not, it means working quietly and consistently on sometimes unpopular topics and biding our time until a window of opportunity opens up. COVID-19 is a wonderful example. In March of 2020, when everything was shutting down and panic was ensuing, we were approached by government officials looking for solutions. The safety net could not continue to function as it was because it was so dependent on in-person interactions. So my colleagues had conversations, dusted off issue briefs, scoured regulation and legislation, and helped develop a game plan which was largely implemented in Ohio. We had been building the trust of public officials and our expertise over the course of years. So things like pandemic electronic benefit transfer, or PEBT, so that kids that weren't in school could still get free and reduced breakfast and lunch, they were put into place. Pausing Medicaid redetermination so that people could remain on their health coverage during this global pandemic and public health emergency. Temporarily increasing SNAP benefits to make sure that even if someone lost their job, they were able to put food on their table. Those were all suggestions that Community Solutions put forth during this time. I can't emphasize this enough. There was so much innovation in the health and human service space during COVID. Now it's our responsibility to figure out what worked and why, and to hold on to those things that worked. And that's something that our team is working on actively every day. I want to talk a little bit about the team at Community Solutions. We're a staff of about 25. Our main office is here in Cleveland on East 9th Street, but we have a small and mighty group in a Columbus office who focus on state policy and working with the state legislature and executive branch. I have the joy of working with a smart, curious, committed, and knowledgeable team. They're the best, and please feel welcome to reach out to any of my colleagues at any time. At Community Solutions, we don't work for any one part of the system. We don't provide direct services, and we get to advocate on behalf of the community, not ourselves. It's a wonderful position to be in. We work from the deepest grassroots to the highest echelons of power and everything in between. And along the way, we try to serve as an explainer and a translator. We try to elevate the experiences of those whose lives are impacted by policy and to demystify and untangle complex policy proposals for those working directly in the community. You can expect to see much more from us in the coming months and years as we work to build the capacity for advocacy among health and social service folks in Cleveland. And in fact, one of the things that I'm really excited about is the upcoming launch of a human service chamber for Cuyahoga County. There is a wildly successful human service chamber in Franklin County serving the Columbus community. This would be a place for a broad range of organizations working in human services to come together to talk about shared challenges, collaborate on solutions, maybe look into a shared health insurance plan if we can figure it out, and also identify a shared policy agenda. So keep an eye out for much more to come in the coming months. Community solutions best work happens when we have elements of what I've come to think of as a diamond with 4 points. And those points are policy, research, community engagement, and strategic communications, because we don't want our work to just sit on a shelf. We want it to be useful and used and to propel progress and cultivate conversations. Some recent examples of work that I'm particularly proud of are our status of women fact sheets. My colleague Angela Marr and I had the opportunity to be on Sound of Ideas last week, so certainly take a listen to that or check out our website to see more. These are data compiled together, 160 indicators of the well-being of women and girls, and we pulled it together for every county in Ohio. So check out those 88 fact sheets. We also recently published some information that came out of a series of interviews and survey with community health workers, those people that are closest to on the ground. They're the closest that you can come to being on the ground in the health space to talk. And they talked a little bit about some of the challenges that they're facing in their own profession, as well as those that they're seeing community members face. It's wonderful work, and I would encourage you to take a look at it. And then in the coming weeks, there will be released a forthcoming report looking at the impact of inflation on older adults. So we surveyed older adults in Cuyahoga County and also conducted a survey. Their words are powerful, and some of the data is even more striking. Almost half of older adults have had to give up a necessity or choose between necessities in the last year because of cost. But we can do things about it. If you haven't already, I'd strongly encourage you to sign up for our 5 Things You Need to Know newsletter, which is delivered to your inbox every Monday and contains the latest work from Community Solutions, as well as a carefully curated group of things that we hope everyone in the community knows. So the title of today is A Familiar Face in a New Chair. I kept thinking it was an old face in a new chair, but I'm glad you didn't say that. I've been with Community Solutions for a long time, almost 17 years. But at least from my perspective, the move to president and CEO wasn't preordained. Our board opted to undertake a full search process. Over 450 people expressed interest in this job. And I went through a long series of interviews. Along the way, I was able to really think about why I wanted this job and the possibilities I saw for Community Solutions. And that makes it so easy to talk passionately about the organization where we are today and where we hope to go and where we hope to go with all of you to drive change in our community. It's a big task to follow a beloved and transformational leader like John Corlett and to try and honor the legacy of Community Solutions while leading it into its next chapter. We're going to keep convening, we're going to keep collaborating, and hope to remain as a resource as we collectively attempt to tackle some of Greater Cleveland's most pressing problems. So with that, I will pause, and I'm happy to answer your questions.
Emily, thank you so much. So let's start with, you mentioned that folks can access data and reports from Center for Community Solutions. How does that work, and how can they learn from you about how to best use that data?
Oh, great question. So we post all of our work that we're able to release. on our website, communitysolutions.com. The best place to stay in touch with us is by subscribing to our 5 Things You Need to Know newsletter, where we put those things out. For a quick look at data and information, it is our fact sheets, our community fact sheets, that are probably the easiest place to start to engage with some of the data. And later this year, thanks to the generous support of the Cleveland Foundation, we will be releasing brand new fact sheets for Cleveland's wards and Cleveland's neighborhoods, compiling data into locally meaningful geographies. And in terms of the use of data, it's our hope that people use the information sort of as they see fit. Find the particular points that are important to illuminate something about your work and carry those forward and use them. We've seen people use some of the data that we compile in grant requests, in media reports, press releases, in their own reports and needs assessments. Please, we definitely encourage people to use the information that we put out. That's why it's there. That's the benefit of being a nonprofit organization devoted to some of this work. We are going to be launching a new website that will hopefully make it a little easier for people to find and use some of that information. And please, I'd encourage you, if there's something that you're looking for that you can't seem to find, email one of either me or one of our staff members, and we can probably pretty quickly tell you if it's out there in the form that you're looking for or how difficult it is, or if we have it, we'll share it. Happy to do that.
So the data that you're collecting is often around these really complex community issues that can elicit some really strong opinions on either side of that issue and thoughts on what should be done. How do you deal with those situations when the data says one thing versus the perceptions that might not be supported by that data?
That is a great question, and that's the core of the work. So I like to say that community solutions is data informed, not necessarily data driven, and that's what we've encouraged everyone to be, is data informed. So use the data as one input, but definitely listen to community members and use your own expertise to figure out what the data might be telling us. Yeah, it does often elicit strong responses, and the biggest question we often get is why? Why is it this way? And it's the question about why is where we often see some of the biggest differences in opinion. But one of the things that I often like to say is that the data confirm or deny our preconceived notions or what we believe to be true about our communities. And so some great examples are, we often hear, or we have in the past heard, that transportation is the biggest issue facing people. When we go and ask community members, transportation often does not come to the top of the list. It's much more basic things, like food, like resources for their families, like childcare. And so, sometimes we hear a lot about transportation. It makes sense as a barrier, and it certainly is for people. But we just stand behind, the data that we have, how it was collected, what we heard, and to look at the reality of where the community is not necessarily where we wish it would be.
Very curious if you can share some of those initial insights around the work that you're doing of what did work from those innovations during the pandemic.
What did work? I mean, the simplest answer to that is that when we make it easier for people to access the benefits that they qualify for, a whole lot of good things follow after that. Great examples include the Medicaid redetermination pauses that I mentioned that allowed people to remain on Medicaid health coverage no matter what happened with their jobs or their incomes. And actually, that is a major policy success over the last couple of years, is that in the last state budget, the state of Ohio actually made it so that young children up to their 4th birthday, if they're born on Medicaid, they can remain on Medicaid throughout to keep that consistent health coverage, keep kids going to their well visits, which we know has a lifetime of positive health consequences for people. That was a piece of it. Making it easier for people to access supplemental nutrition assistance program. Ohio is one of only a handful of states that still requires new moms to go to an office to recharge their WIC, their Women, Infants, and Children benefits. So imagine being a new mom struggling to feed yourself and your family, and you have to get yourself and your new baby physically to the office to recharge a card. So those are some of the things that we're working on that we saw during the pandemic. You know, they can be dry, they can be regulatory, but they influence the resources that people have available to take care of themselves and their families. And so they're really important.
What issues are on your radar that you feel our community should be paying more attention to?
Ooh, so many issues. There are so many issues on my radar. You know, one of the things that I've been talking a lot about is taxes and a tax code, and seeing if we can collaborate with partners in the state legislature and in state government to have a child tax credit for Ohio. If the federal government doesn't make the improvements, Ohio can too, to think about, are there ways through tax credits or changes that we can help get more resources to families, while still ensuring that we have enough resources to do all the things that government is looking to do. So that's certainly something that that we're interested in working on. Really interested in connecting some of the benefits together. So seeing if there are ways, if you qualify for one program, you can automatically be enrolled in another that has the same kind of eligibility criteria. We're collaborating with several groups across the state to look at the issue of the benefit cliff. This what occurs is that as people are on the path from poverty to economic self-sufficiency, there are places on the path where earning just $1 too much means the loss of hundreds of dollars in benefits for a family, which creates a disincentive to work. The system doesn't work for anybody the way it's currently set up. So are there some innovative solutions that we can come up with, or maybe even some not so innovative solutions to try and make that better? But what I'm really interested in are the places where we see connection between several community issues and the places where one solution can help with several different issues. We're starting to talk about seeing how we can connect Medicaid and healthcare with schools, with school-based health clinics that we have. We have several in communities across Cleveland. They work really well. And not only do they help with children's health, they help with attendance, and they also help parents who don't have to take time off to make sure that their children get the health care or the dental care that they need. And so can we expand those programs? And can we expand them to behavioral health, for example, an acute need that we see, especially in young girls and teens?
So advocacy work is so important, but it can feel very daunting and many might not know where to start. What recommendations would you have for someone who is interested in advocating for policies to feel really effective?
Yeah, you know what? When you work on advocacy, it often is like shouting into a black hole. It definitely feels that way. But you know, we all have a voice, and one of the very first things that I would encourage everyone to do is vote. If you don't agree with the people who are in office representing you, please be sure to vote, and encourage those that you work with to also vote. As nonprofits, we can't tell people who to vote for, but we absolutely can encourage people to vote. So that's really at its very base level, is doing that. But then I would say find an issue that you're passionate about. Write a letter to a legislator. Still, handwritten letters mean a lot more than an email, although email is easier. See if you can find the people and the places that are already advocating on that, because we're always looking for people to join us. And then Community Solutions has some plans to reinvigorate some of the advocacy trainings, especially for nonprofit professionals that we've had in the past, to try and provide those very concrete suggestions. But especially for those who are working in communities, sharing the stories that you're hearing are stories that legislators don't often get to hear. and they can make a real difference. So coupling those stories, maybe with some of the data about how many people are impacted by an issue, is a way that we can all share our expertise with those who are making policy.
Where do you feel the Center for Community Solutions has made the greatest impact?
Mm. That's a great question, and there's a lot of areas where we've made big impacts. I think in recent years, probably the place where we've had the largest policy successes is in the Medicaid program, and some of the things that we've been able to work with the state of Ohio to implement. The leadership helps. The people that are sitting in the chairs now are those that are very familiar with community solutions work. And so these aren't things that you'll see on the front page of the paper. They're often regulatory, but really do make a difference in people being able to access those resources. The other place that I'll say that we've had an impact is in helping groups across the state take a clear-eyed look at where their communities are and where some of the levers might be and the issues might be through our work doing needs assessments for government, for health systems, for nonprofit organizations, really examining what are the needs of the people we're seeking to serve.
So, as you have stepped into this leadership role, you are one of many new leaders across the community. What excites you or concerns you about this leadership renaissance we're seeing in the Cleveland and Northeast Ohio community?
Yeah, something that really grounds me is that, like me, so many of these new leaders have been leading. They've been leading, been working in the community. May not have the name on the door if they're elected officials, or may not, be in the top spot in the organization, but still have been leading behind the scenes. And so that's really exciting that we have sort of a group of people that have been working on these issues a long time stepping into more prominent roles, and I certainly feel that every day. So I think fresh eyes often see nothing but possibility, but those with experience can see how far we've come. And I think with some of the leadership transition, we hopefully get the best of both here in Cleveland. We can sure use it. And someone new in a chair opens up opportunities for new conversations, or to re-engage in the same old conversations in new ways. So, it's an opportunity for all the issues that we work on.
As you look ahead to the next few years, what is the vision you have for the organization, and how can those of us on today's call support you in achieving those goals?
Oh, thank you for that question. Yeah, so, part of the vision is continuing what has been so successful, or what has been successful in the successful times over the last 111 years. We haven't always been impactful and successful. For me, what I'm most excited about is are those areas where that diamond, where we can bring together our competencies, where we can convene, where we can collaborate, where we can point out things that might sound like simple solutions that we haven't done before. And so, would certainly encourage all of you to be engaged with community solutions and let us know if you see those opportunities, because we can always go and explore things. We're always open for good ideas.
Thank you so very much, Emily. Your words have challenged us, inspired us, and I know you're going to have new subscribers to your Monday 5 Things You Need to Know. So we're very grateful for your work and for the passion that you have to improve our Northeast Ohio community.